Nursing students, what to do when a test question shows you your patient's CBC and then it asks you what to do next, and every option looks right. Let's say your patient has a fever, but they also have low white blood cells. What do? Okay, girl, this is one of those test questions that would try to trick you. So, on exams, you should first ask yourself, do I need to assess first or do I need to implement first? And this will be based off if you have enough data about your patient in the test question to safely implement. Whenever the symptoms do not match the labs, you assess first. In this situation, you would assess first because when a person has a fever, they normally have high white blood cells. So when it's a fever and they have low white blood cells, something deeper is going on. You should assess your patient's medical history for diseases like lupus or rheumatoid arthritis, infections, HIV, cancers, or if they recently underwent chemotherapy treatment or they're taking immunosuppressants like prednisone or methotrexate. The history tells you if you should expect your patient to have low white blood cells, or if it's not to be expected, then it's a red flag that requires immediate action, guys. So, your patient has low WBCs. That means that their body cannot fight off infections as well, and they are at increased risk for getting infections. So, even if your patient has low white blood cells and they're symptomatic, showing signs of infection, fever, chills, body aches, confusion in older adults, your nursing priority should be to protect them from infection by practicing safe hand hygiene. They may be placed on neutropenic precautions while they're in the hospital. You will encourage them to wear a mask when they're out and about with others. You will advise them to avoid sick contacts as well as to stay up to date on their vaccinations. So, if they weren't in the hospital and they were at home, you would teach them to seek care fast for signs of infection. So if they just had low white blood cells and they were going home, you would tell them to follow back up as soon as possible if they start having any symptoms of fever, body aches, confusions, UTI, if they were coughing up green or yellow sputum. So, even if it is suspected while caring for your patient in the hospital, you would still notify the provider because a fever with low white blood cells can turn serious really quick. In this same situation, when would you call a rapid? If your patient presented with signs of sepsis such as high fever, tachycardia, low blood pressure, or changes in mental status, don't wait, guys. So, use this assess versus implement framework on your next exam and you'll stop second guessing and start picking the best answers fast. Good luck, ladies. You've got this.